That's right, 812 Live, Bernama Radio 24. Thank you very much for staying with us. At the lounge this evening, we speak to Associate Professor of Cardiology, Dr. Sazzli bin Qasim, from the Department of Cardiology, Faculty of Medicine, University Technology, Mara. He's here in the studios to talk about hypertension statistics in Malaysia, as well as the latest hypertension guidelines in Malaysia. Prof, very good evening to you, and welcome to the show. Thank you very much for joining us.
Thank you very much for having me.
There's a lot to be talked about when it comes to heart disease and hypertension in Malaysia. Apparently it's on the rise. Absolutely. And I hope you don't have alarming stats for us. It's good stats, and of course we're going to be walking through the guidelines. But before we get into that, tell us about your role in University Technology, Mara, how long you've been there. Just a little bit of an introduction.
Oh, very good. Thank you very much. Well, I've only been back about 2 years now, and I've been with UITM since March of 2012. So that's coming up to 2 years now at this point. It's a fairly new unit. We're located based mainly in Sungai Buloh, just outside of Sungai Buloh Hospital. We're quite separated from the Ministry of Health Hospital. And it's a very nice unit. It's a very nice facility. We have a 5-story building, pretty much with our own cath lab. We've been doing operation bypasses, stenting. We have our cardiac CT and cardiac MRI. So we're a full running unit now. But fairly junior, fairly green. But, we'll be growing in the next few years, I say.
Right. Is it run as a private wing or as like a general hospital?
It's it's not a private wing. We serve all government referred patients, patients from government hospitals or even private clinics or other private hospitals. If they're referred to us, we'll look after them.
Right.
If they are government patients, then they come for free. But if they're cash paying patients, they pay a very nominal fee. Mind you, it's a lot less expensive than some private hospitals.
Right. But the work you're doing there, and if you compare the work you're doing there to what we call the gold standard of cardiology work, which is IGN, just across the road from where we are, is it the same?
We want to.
And
think
the services offered, right?
As I said, we're only 2 years in, and we want to think so.
Right.
We're not there yet, I would have to say. IGN have gone leaps and bounds, and there's a long way for us to catch. But for example, they have 11, 15 consultants. UITM have 1 or 2. Sorry, excuse me. Professor Dato Khalid Yusuf is there as well, so that's me and him. So we will be growing. Hopefully, we have 8 trainee cardiologists who will be finishing their training in the next couple of years, who will then rise up to the ranks and take up more responsibility in treating these cardiac patients. So we can only grow. And we'll be busier. Are we at IGN's level? Some of the way that we treat patients, some of the diseases, yes. Like coronary artery disease, yes. Opening up acute MIs, heart attacks, yes. Sending them off for bypasses, yes. Doing valve surgery, yes. Some of the things we still can't do because we lack the manpower and the know-how. Like treating rhythm, electrophysiology, those kind of things we can't do well right now. But hopefully we'll be able to attract more to join our ranks.
Right. From there, let's talk about what you're here to talk about, hypertension. What is hypertension and what are the symptoms? And are there any warnings that we should watch out for when we are, looking out for hypertension signs and symptoms within our body?
Yeah, that's a difficult bit, isn't it? Because hypertension has no signs.
It has no signs.
No symptoms unless it's very severe. Most of us walk around without knowing that we have high blood pressure. That's the sad bit. Like 30% of Malaysians have high blood pressure. And of those who have high blood pressure, only a third know that they have high blood pressure. The other 2/3 don't even know that they have high blood pressure.
Right. But I don't know how far this is true, and I've checked with a few doctors too. When they talk about signs and symptoms of hypertension or high blood pressure, it's always about, a lot of people complain about the pain in the neck, but they say now, if it's astronomically high, then you probably get a pain at the nape. Yeah.
Correct.
Yeah.
That's the thing that as I was saying, most of the time people don't get symptoms. You could be walking around with a high-ish blood pressure, normal being 140/90. You could be walking around with 160/say 100, not being aware about it, feeling a bit tired maybe. when your blood pressure hits, say, 180 or 190, that's when you start getting, very lethargic, tired, headache, can't really focus. If it goes up very quickly, very suddenly, then it can affect your organs, like your brain. You can get symptoms like stroke. It could affect your heart. You could fail suddenly, not being able to pump because the pressure is so high. Then you start to retain water in your lungs. You go into heart failure. And then your kidneys could be affected as well. Your kidneys can't tolerate very high pressure.
So can we safely say, from what you're saying or what you just said, can we safely say that a sign of when you have lethargy, it may be a sign of hypertension?
Not lethargy per se, because a lot of things cause lethargy, but lethargy could be a sign that you've been overworked and too much stress and so on. So, but lethargy, chronic headache, not being able to focus, those kind of things are things that you should be aware of. Those are things that you should be picking up on and saying, maybe there's something wrong with myself. Let's get it checked out. Right.
So the best way to do it is a simple blood pressure test that can be done anywhere, even in a pharmacy. Well, when it comes to reading blood pressure, not many of us know what these numbers are. So can you just briefly walk us through blood pressure, what's normal and what's not, so on and so forth?
Yeah, so as I said, you have two numbers, the upper number and the lower number.
Okay.
The normal for the upper number is not more than 140. What the upper number reflects is pretty much the work that the heart does when it is contracting. So that's what it does. It reflects how much work, how much pressure you have when the heart is actually contracting. That's your systolic pressure when the heart is actually contracting. And the blood vessel is exposed to this sudden surge of blood coming from the heart. That's your systolic blood pressure. That's the upper number, 140. No more than that.
No more than 140.
No more than 140.
So the upper number should be no more than 140.
No more than 140.
Right.
The lower number, we pay attention to the upper number most of the time. Almost 90% of the time we pay attention to the upper number. The lower number reflects the pressure in the blood vessel when the heart is relaxing. So how much pressure is the vessel exposed to, or how much can it relax? And it shouldn't be more than 90. But we pay attention to the top number. If your top number is less than 140, then chances are you will do okay. You just need to tweak your lifestyle a tiny bit. But if it's consistently above 140, you need to do something about it.
So if your blood pressure is low, where will the upper number be?
Like a normal-ish blood pressure, you're aiming for 120 over 70.
Right.
People could walk around with a blood pressure of 100 over 90, even 90 over 60. That's no problem. As long as they have no symptoms, low blood pressure, they live longer and they'll do okay.
So these are things you need to look out for. And if you don't understand these numbers, please ask or check with your doctor what they mean, and that would give you a broader understanding as to what problems you're having. When it comes to diseases surrounding hypertension, there's no end to it, yeah? So where do we start with this?
Just to carry on from the last one, when you go to check your blood pressure, do ask your doctor what the number is. And remember what the number is and jot it down in a little diary.
Right.
Because it'll be useful for you to record your numbers,
Right.
The reason for that is if your blood pressure reading is persistently high, beyond normal, say 160 over 100, you're on medicine and your medicine is not really controlling your blood pressure very well, but you're reluctant to go on more medicine, you're not inclined to exercise, you still binge on salt and so on. So what tends to happen is then you start to get organ damage, or the earliest damage is the damage to the blood vessel itself. So your heart has to contract to pump all this blood out. The higher amount of pressure is exerted to the blood vessels, so the blood vessel then react by becoming thicker. When they start to become thicker, they can do two things. Either they become weak and they start to dilate and become weaker, and then they could suddenly burst, and then you start having bleeding to the brain, for example. Or they could narrow down and you start to have compromised blood flow into the organ, to the structure that requires blood supply. Like the brain, you could have a stroke. Or into the heart, you could have angina or a heart attack. Or into the kidney, you could start going to kidney failure. So that's a mechanism of how prolonged elevation of blood pressure is detrimental to your body. To your heart, for example, once you start having a narrowed blood vessel, if you are lucky, and say your cholesterol is quite stable and your diet is healthy, but you just have high blood pressure, nothing else, you don't smoke, your cholesterol is okay, you don't have diabetes, so you only have high blood pressure, chances are the blood vessels will just narrow down progressively with time. And sooner or later, you will get symptoms of angina, chest pain. That's when you get a bit tight in the center of your chest when you do exertion, when you do a bit of physical work. That's a lucky one. You'll get symptoms and signs. So then you can go off to your doctor and say, oh, look, doc, I have a bit of chest pain in my chest. What do I do? Doctor will put you on, give you an ECG, put you on a stress test machine, get you to walk, try to reproduce the symptoms. And if it is reproducible and you have some changes on the ECG, then chances are the artery is blocked and narrowed. You need to go in for a procedure, get a stent put in. There's many different types of stents, and to cure your symptoms.
Right. Some people unduly worry when they have to go for an angiogram or put a stent in, so on and so forth. We're going to be talking about that shortly.
Yeah.
But ideally, if I'm working, let's say, in a very stressful environment, for the sake of an argument, let's take advertising or entertainment.
Entertainment.
Right? Okay. Yeah. So it's a stressful job. You eat at different times. You eat horribly, and you smoke. You do whatever else. How often do you need to check your blood pressure?
At least twice a year.
At least twice a year?
At least the bare minimum is twice a year.
Okay, that's the bare minimum. Yeah. What would be ideal?
3 monthly.
3 monthly, yeah.
If that's the kind of lifestyle that you have, where you can't really, you have to be in control of what you do, I suppose. You're ultimately responsible, but sometimes we can't control what's fed in front of us, And if your lifestyle is very stressful and you can't control what you eat, there's a lot of excess salt in your diet, and you can't exercise, then you do need to pay attention to your body a bit more. So that's a bit where we say that you need to modify your lifestyle. And the first thing that you do is go and see the doctor more frequently, number one. For example, some people, just to modify, you just need to tweak your lifestyle a tiny bit. You don't have to do like massive changes, just tweak a tiny bit. Just eat less salt, go upstairs and those kind of things. Right.
So ideally, if you're going to check your blood pressure, do it every 3 months.
If that's the kind of lifestyle that you lead, but the bare minimum would be twice a year.
Right. Of course, there's another set of us, and I'm a self-confessed hypochondriac. We're going to come back and talk about those of us who check our pressure on a weekly basis. Stay with us right here on 812 Live, Bernama Radio 24. We're currently speaking to Associate Professor Dr. Sazzli Kasim, who's here to talk about hypertension statistics in Malaysia, as well as the latest hypertension guidelines in Malaysia. Later on the show, we'll be talking about the 11th annual scientific meeting of the Malaysian Society of Hypertension, which is happening at Shangri-La from the 17th till the 19th of January. We'll come back and give you more details as to what's happening at this event or meeting, which runs from the 17th till the 19th, right here on 812 Live, Bernama Radio 24. Thank you very much, Uncle Patrick. Welcome back to the lounge. We are currently talking to Associate Professor Dr. Sazzli Kasim. We're talking about hypertension statistics in Malaysia, as well as the latest hypertension guidelines. Before we get into that and the guidelines, which is more important, we want to find out about, we were talking about checking your blood pressure, so on and so forth. And ideally, if you're living a horrible lifestyle, you need to check it every 3 months. At best, or rather, at least, you need to check your blood pressure twice a year. Well, for those of us who worry about this overly, and I'm one of them, and check our blood pressure, say, every fortnight, does that make a difference?
Yeah, absolutely, it does.
It does?
When you empower yourself to check your parameters more frequently, it does give you a certain control, feeling of control to your life.
Right.
And absolutely, you're the ideal patient because you will be easily to convince. The intervention would probably prevent you from getting more, harmful sequelae.
Right.
But you have to be logical about it as well, because you do not want to allow those numbers to overpower your life. And when it does, then it becomes an unhealthy scenario. There are patients who check their blood pressure every day. There are patients who check their blood pressure twice a day and start to feel their heart rhythm just in case they get the extra heartbeat. Oh, doctor, am I going to die of a heart attack? Oh, no, you're not, man.
Right.
But and those are the kind of patients where you spend a lot of time reassuring them, just relax and you'll be fine. We'll do all the tests, we'll make sure you don't have anything serious. But we do know that deep down inside, when anxiety plays a major role, then it doesn't really help things.
Well, let's move on and talk about the diseases surrounding hypertension.
Yeah.
Okay. You did talk about an angina a while ago.
Yeah.
And a lot of us don't understand what an angina is. Now, I also know of people who didn't have a heart attack, had symptoms of a heart attack,
Yeah.
and they were lucky because of narrowed arteries. It was opened up by a stent, and they're leading a normal life again. But they're afraid to lead their normal lives.
Yeah.
Should they lead their normal lives, or should they be cautious
Well,
when it comes to exercise?
yeah, absolutely.
Yeah.
Those patients who say had symptoms of angina. Angina is pretty much central chest tightness, which is worsened when you do something, and it's relieved by whenever you rest or you pop a little pill in your tongue called nitrate, GTN. That's what angina is, and it reflects that you probably have narrowing of the arteries of the heart, arteries that supply blood to your heart muscle. So for those guys who are lucky to have symptoms of angina, and I say lucky because they get warning that their heart is in trouble, and they can go and see the doctor, and they can get something done about it. They can get a stent put in, they can go off and get a bypass, What do they do? For us, if they did not have a heart attack, what we tell them to do is, yes, you can go back to your normal routine, but you have to start slow and build up your confidence all over again. We see them regularly to assess how they are getting on. In those who are extremely worried and they don't know where they stand in terms of physical activity, sometimes a stress test might be useful to try and convince them, only to try and convince them, not to try and provoke symptom or to try and demonstrate that the artery is narrow, but to try and convince them, look, you can do 9 or 10 minutes of exercise stress test. You can do the same thing when you go home. And what sort of activity should you be doing? Pretty much, if you don't have any symptoms, and your blood pressure and everything else being okay, then you should be able to carry on with all your routine day-to-day activities.
And when you talk about heart disease and hypertension, there's always the saying that heart disease and hypertension discriminates racially. Can you walk us through this?
Yeah, absolutely. Racially or culturally, rather, and it's the way we grow up, and it's the lifestyle that we are exposed to.
Because there's a saying, if you're Indian or Malay, your chances are higher, man. Yeah.
three times higher than the Chinese population, unfortunately. And Indians and Malay are known to have excessive amount of santan and salt in the diet, and spices,
which we love.
Oh, the curries are fantastic. I have to admit, it's one of the reasons why I came back to Malaysia. But we have too much of it. And we have, say, even nasi lemak roti in the morning, and then at lunchtime we have a big lunch with a huge portion of rice, which increases our risk of diabetes. And then in the afternoon we have our kueh, and all those things. And at night time we eat again. And in between we don't do any exercise, so all those calories are just being stored in our body and not being burnt off. So where do they go? They go to the hips. What happens then? Your pancreas can't work properly, so you then become at risk to develop diabetes. And when you have diabetes and hypertension, that's almost the end game for you, because you're almost guaranteed a heart attack or a stroke within 10 to 15 years. So it's actually worse than cancer, because with cancer, well, not worse than cancer, but with cancer, the disease is very severe, and you have to prepare yourself mentally and physically, and you know what sort of treatment you're going to have. With diabetes and high blood pressure, you can walk away feeling normal, and then suddenly, boom, it hits you. And your life changed forever.
Right,
for a long time.
Best case scenario is you're ejected to your next life or whatever that's out there.
Oh yeah.
And when it comes to hypertension, there are statistics in Malaysia. Is hypertension a leading cause of death in Malaysia? And how do we measure against other Western countries or other countries?
You can't. At this point we can't really say hypertension is the leading cause of death. What we can say and what we do know is that cardiac disease, cardiovascular disease, let's put it that way. So, heart attack, heart failure, stroke, is the number one killer for Malaysia, and a lot of the Western countries and a lot of countries worldwide, really, to be honest, more so than cancer, more so than infection, more so than dengue. And we do know that hypertension is a major contributor to the development of cardiovascular disease. When you compound it with diabetes, when you compound it with poor lifestyle and smoking, that's it. It just, your risk increased by 8-fold and sometimes 18-fold, depending on how bad your sugar is. How do we compare to Western countries? In the West, a lot more emphasis is given on primary prevention. What that means is that treating the population, bringing down the population's risk to develop cardiac diseases. So what they do is that they scrutinize and screen everybody's blood pressure quite religiously, and do very aggressive screening for diabetes and cholesterol. And when they find these things, they also provide treatment at a very low cost. We're doing the same thing in Malaysia, but I think our reach is probably not reaching out to the people that matters most, i.e. those people in the urban territories where their lifestyle is actually well ahead of them to cause an increased risk to cardiac diseases. So what we're seeing in the West is a drop in terms of mortality, in terms of death from cardiac diseases. We're seeing a similar trend here as well, but what we're seeing here, unfortunately, is a rise in obesity, and a rise in diabetes, and a rise in hypertension. And you can easily predict by 2050, 2040, the epidemic is going to be catastrophic.
Right, and I'd like to personally thank the fast food outlets that have fast-growing the franchises that have come across to help us with our aim to becoming an obese nation. And apparently we are on top of the list of countries where diabetes is concerned, and with heart attacks being a common illness as well. How much of a priority is hypertension on the national health agenda as of now?
It's number one. Between diabetes and hypertension, they walk hand in hand. We do really have to tackle these two diseases at a grassroots level. We really have to try and screen everybody, control their blood pressure, make sure they lead a healthy lifestyle. In relation to fast food is fantastic for the busy lifestyle, isn't it? But the amount of salt that gets thrown in there is unbelievable. Even if you go to McDonald's, and McDonald's is pretty good in a way that they actually publish the amount of calories, amount of sodium, amount of saturated fat, and so on and so forth.
It's like just going out there and saying, this is how we kill you.
Yeah, this is your poison for today. My advice is, if you do have to eat at McDonald's, take fries, for example. Ask for salt-free fries.
Right.
And that will probably reduce your risk of contracting high blood pressure. You can't do anything about the burger because all the salt is thrown in there already, and mayonnaise and so on and so forth. But that's one step that you can do if you have to go for it.
Well, the new guidelines for hypertension are being released, and what are the guidelines used for? How are we going to use these guidelines to the benefit of the nation?
This guideline pretty much is meant for medical practitioners, number one. It's been almost 6 years since our last guideline. The last guideline was published in 2008, and it's published by a working group chaired by the Ministry of Health, and it's meant for the use of all medical practitioners around the country. And it actually spells it out one by one on how to tackle from the simplest screening of high blood pressure to the treatment of very complicated high blood pressure associated with an organ disease and damage and so on. It also tells you how to screen for the young people with high blood pressure, how to deal with the diabetes associated with high blood pressure and so on. When we do these guidelines, we reflect our local statistics, and we look at the best available evidence. And unfortunately, we are still relying on a lot of evidence from first world countries, from the West, from Australia, from Europe, from America. If we were to look at the timing of the launching of the guideline, America published a hypertension guideline last year, so did the European Society of Cardiology. So we're following suit so that our guideline is pretty much up to date to the current practice. Gone are the days where we are discriminating diabetics. Prior to this, we were saying, okay, if you're diabetic, your blood pressure should not be more than 135/85. So it's 5 points lower than somebody without diabetes. It's great because if you do that, then your diabetics will get better control and hopefully less risk of kidney failure and heart attacks. But sometimes if we can't do the basics right, then we get everything wrong down the road, So now we've removed that, and the whole goal is to treat everybody's blood pressure to less than 140/90.
And with these guidelines being released, when will they update these guidelines? How long should we wait for? Another 5 years before we update them?
It pretty much depends on what happens if people review the outcome of the guidelines, and are we achieving our targets, and where are we missing out on? Plus reviewing the best available evidence. Thing is about medicine is it's not exact science, so you really do need to challenge your knowledge and challenge your intervention all the time. Say for example, coffee.
Right.
Let's take coffee. Coffee is good for you. Coffee is bad for you. I don't know. Right. Some scientists in France, what they did was they took they look at all the papers that contains publication with coffee, and they found that people who drink, say, 2 cups of coffee a day have lower blood pressure. Therefore, coffee is good for you. But people who drink excessive amount of coffee, say 3, 4, 5 cups a day, increases their blood pressure. Therefore, it's bad for you. So really, there's a fine balance of how we do things, and without doing these experiments, we will never know. Green tea is the same. The Japanese and Chinese and Koreans, they have a lower risk of cardiovascular disease. And people were asking why. Is it a fish diet? Is it because they walk everywhere? Is it because the weather is cooler than Malaysia? And some bright spark look at green tea. And what they found was that if a female Japanese woman were to drink 3 cups of green tea a day, it reduced their risk of stroke, but not for males. So there's a lot of discrepancy of what we know.
But just last night, within the BBC, there was a new article released about using green tea and how it blocks certain medicines that you're using, especially for heart problems. It doesn't help in helping these medicines dissolve, something to that effect. They were talking about that yesterday, and they now say that if you're having cardiovascular problems or heart problems, you shouldn't be taking green tea.
So it's not a hard and fast rule, to be honest with you. I think if you want to look at it, being logical about it is really to do it in moderation. When you say green tea is good for you, my fear is that there will be some punter, some fella out there who will be consuming bucket loads of green tea.
That's right.
Try and flush out his cholesterol. It doesn't work that way, And unfortunately, when they publish these things and people hold it on as if they're the word to follow, and they're very obsessed with it, and you just can't live like that.
Right. From there, let's talk a little bit about the Malaysian Society of Hypertension and what do they do. A lot of tense people in there.
Well, Malaysia Society of Hypertension, MSH, it's founded in 1993, and the whole idea was to try and increase the awareness of the effects and sequelae of hypertension to the nation as a whole. So they're an NGO, and they've done a lot of work on the ground, as well as participating with other NGOs to try and increase awareness. Like last year, for example, for World Hypertension Day, they organized a run in Setia Eco Park to try and get people to be more active.
Yeah, I think we did speak to someone about that last year. Yeah,
very good. So there you can see the effects of the efforts of the society. It's a long way to go. And we can't do it alone, unfortunately.
Right. And going back to what you said a while ago about, I asked you a question if hypertension discriminates, and you said, I continue to say, does it discriminate racially? And you said culturally. So culturally, if you look at it, all of us eat very badly in this country, and if there's one thing that has to change, it is that. And the efforts on the ground would be to change people's mindset, and I'm sure the only way it can be done is to go down to the younger kids and teach them healthy eating and healthy living.
Yeah, absolutely. I think there were a period in time where the school kids were exposed to unbelievable amount of what we call it rubbish diet, and the school canteens, a lot of sweets. With MSG
used as a base.
A lot of MSG, a lot of sweets, a lot of salt, and that's quite worrying because, and you see yourself as well. There's a lot of children out there who are slightly heavy and who are borderlining on obesity, and that's quite worrying. How do you teach these kids? And it really does fall back to teachers and parents, I think. Because if we are able to teach them what's good, what's bad, what's healthy and what's not, and if we really do look after what they actually consume, we spend a bit more time in that way, I think we can prevent, we can teach them what is healthy food. We can really prevent this obesity epidemic from raging on. Obesity is quite scary, really, to be honest.
Right. And if this is going out to the general public, and if people want to obtain information about hypertension or get some information and data, is it available at the society?
Yeah, you could visit our website, www.msh.my. It's a fairly big website, fairly comprehensive. We're trying to make the website more education friendly, so we'll be putting up more articles, and even some of the talks that we will be having for this weekend by our international and local speakers will be putting into PDF format so that people can access it readily.
Well, we're coming to actually the 11th annual scientific meeting meeting of the Malaysian Society of Hypertension, which is taking place at the Shangri-La Hotel from the 17th till the 19th of January. So what's this all about, and what can the public do to make this a success?
Number one, the meeting is pretty much an annual scientific meeting. So it's pretty much geared up for the allied health and medical practitioners, so doctors and nurses alike. This year we'll be seeing huge names, and one of them is Prof. Salim Yusuf, who is probably one of the biggest names in cardiology worldwide. So he'll be coming by and he'll be giving a series of talks. For the public, we've actually organized a public forum for the Sunday afternoon between 2 and 6 p.m. And during that public forum, we will have speakers, and amongst them includes Datuk Kukalin, who, as you know, has just recently published his book, his cholesterol journey. Our second speaker will be a life coach, and our third speaker will be a fitness instructor. And during that public forum, we will be also offering free cholesterol and free glucose and free blood pressure checks. And they're all free for the first 300, mind you. It's nothing, free forever, but it's free for the first 300. So it's on from 2 to 6 p.m.
It's on from 2 to 6 p.m. From the 17th to the 19th.
On a Sunday.
On a Sunday, it's on from 2 to 6 p.m. So,
in Shangri-La.
Right. If I want more information about this, I can also log on to the MSH website, and all the information is there. Right. Very quickly, before I let you go, there's a lot of talk about alternative therapy. And a lot of people are going out there and buying into what I call buying into these schemes which don't help. But someone once did talk to me about chelation, and I think we spoke about this over the air. What are your thoughts on chelation therapy?
Chelation or Bekam. Yeah. People might feel a bit better after they do it.
Right.
They feel that they have released the toxins from the body.
Are they really releasing toxins?
No, what happens is that pretty much when you do chelation therapy or Bekam, what it does is you put a cup on your skin, make a tiny nick on the skin, put a cup on the skin, and put vacuum suction on it.
Yeah.
So what you're pretty much doing is you're actually sucking blood out of your skin. And blood over time will gel and will clot. And blood clots pretty much looks black, right? And whenever it's very dramatic. So when you look at it, oh my God, my blood
all
is
this
black.
dirt.
All this dirt from the air, from all the cigarette, whatever,
Yeah.
So they think they've done a bit of good to themselves. And it's quite scary, really, because I've seen patients suffering from dengue, and their first port of call would be a sensei, and who does a bit of bloodletting for them. And when they come in, dengue, you drop your platelet, you lose a bit of blood, and they come in, they're dehydrated, and they say they've gone for a bit of bloodletting, they're even more dehydrated. I said, oh my God, what are you doing? So does it work for you? For somebody who suffers from hypertension, amazingly, it does bring down the blood pressure down a tiny bit, but it's not sustainable. It's not as effective as medicine, so I would not recommend it as a lifelong therapy. If you are going to go down that line, make sure you get it checked quite frequently, and make sure that all your other risk factors are controlled for, because it is an unproven science, to be honest with you.
Well, the medical fraternity and also the medical industry, or the services within the country, is evolving pretty quickly. And what the ministry wants to see, and also the government wants to see, is a balance or an equilibrium between conventional medicine and alternative medicine. Do you think we'll find that balance?
It's quite difficult, I would think, simply because for some reason Malaysians are, and I'm being a bit generalist here, I'm sorry, we are very quick to believe testimonials. If somebody comes up to you with an MLM product, and they'll give you 20 testimonials that Mr. A, B, and C says this is the best thing in their life that they've ever had, you tend to believe them, and then off you go buying those products off them, which is very dangerous, because those are the good effects of those testimonials, but what you're not hearing is the bad effects of those testimonials, which is the reason why compliance to medication can be quite challenging sometimes. When you have two type of therapy, conservative, and the other one is being alternative, if the alternative therapy is proven, is safe, and brings down and controls whatever parameters that the disease has, then maybe it will be complementary. But at this point in time, there's not too many of those available. You still need a lot of research and a lot of money to be poured into that segment. Right.
Your take-home message to the listeners of Bernama Radio 24 with regards to hypertension and also the 11th annual scientific meeting?
Change your lifestyle, one step at a time. start with salt and sugar, and go upstairs. I think those are pretty basic, really, to be honest with you. But if you are fast food going, just ask for less salt French fries, and you can start from there.
And with regards to the upcoming meeting.
Oh, absolutely. I would love to see a huge public response for the Sunday afternoon, 2 to 6, and come and listen to Dr. Kukalin. We'll answer all your questions.
Right. Yeah. If you have questions, please get there 2 to 6 in the afternoon. That's on a Sunday, yeah?
Sunday.
Right. 2 to 6 in the afternoon. Be there at the Shangri-La. It's at Ballroom. Is there?
It's in a business center.
The business center. Yeah.
Almost down the basement.
Right. So just get there. If you have any questions, write it out, and you'll have the best there answering your questions. You'll get all the answers you need about hypertension and cardiovascular problems. Yeah?
Absolutely.
With that, thank you very much. We just spoke to Associate Professor Dr. Sazzli Kasim, a cardiologist from University Technology Mara, he's the Associate Professor of Cardiology from the Department of Cardiology, Faculty of Medicine, University Technology Mara, to be exacting. Thank you so much, Doc.
Thank you.
Stay with us. Coming up shortly is News 24 Extra, and the next hour will bring you Hikayat Kita by Ninot Aziz. For now, here's Zainal Abidin and Damai.